It's Lauren here. So today's video is going to be on long-term care staffing. Okay, so if you are a long-term care nurse and you are doing your 9 a.m. med pass, again, I'm only talking about the 9 a.m. med pass, not 9 p.m., not 5 p.m., just 9 a.m. So if you're doing that med pass and you feel like you're stressed, it's not enough time, you can't get it done, I'm here to tell you it's not you, it's them. It's not you, it's the workload that you are expected to do is unrealistic, and I'm about to explain it to you. Okay? So if your situation is like mine, I have 26 patients. For a 9 a.m. med pass, 26 patients. So for that 9 a.m. med pass, you have from 8 to 10, right? 2 hours. Wow, that's a lot of time. 2 hours. It sounds like plenty. It's not. So if you have 120 minutes, 2 hours, you divide that by 26 patients, you get 4.6 minutes to devote to each patient. I'm going to let that sink in for a minute. 4.6 minutes. Basically nothing. Let me explain. This 4.6 minutes includes popping the pills, walking to the room, knocking on the door, providing privacy, having that dialogue before they actually put the pills in their mouth. Hi, so-and-so, I'm here, have your meds. Then they have to get in the position to actually take the meds, right? This is not a 20-year-old patient. They could just pop up in bed real quick and take the meds and lay back down. No. They're going to take a little while to sit up, or you have to get the bed removed, put the head up, let them move around a little bit so they're in a safe position to swallow pills. All that takes time. Mind you, you're also washing your hands before you go in. How much time do you think you just took up? Popping the pills, walking there, having a dialogue, washing your hands. That's a good 2-3 minutes right there. You're only allowed 4.6 minutes a patient. Okay? So, things I didn't even say yet. Locking the med cart, covering up your names, locking the computer screen for all those HIPAA reasons, right? Then there's other things that make you, they're not distractions, they make you deviate from your med pass. These things are breakfast. The state's rules stand, right? The state says you can't give medicine while the patient is eating. That is not allowed. So that time when they're eating, when they have their tray in front of them and they're eating, you cannot give them medicine. You can't walk in and interrupt their mealtime. Okay, that's time out, that 4.6 minutes. How about you get a phone call? That's more time out, that 4.6 minutes, that those patients deserve. Say therapy comes up to you. Say the DON comes up to you. Your unit manager comes up to you. Occupational therapy comes up to you. Speech therapy comes up to you. A CNA comes up to you. Housekeeping, maintenance. All these people are interrupting you, possibly. And all them people, mind you, will be in your way. When you go to give that patient their meds, speech therapy might be in there with them. Physical therapy might be in there with them. Maintenance might be in there. Housekeeping might have the room blocked off. There are so many things preventing you from actually doing your med pass that need to be accounted for. That's not it. How about people who are, the patient's got to be up before breakfast, right? Those bed-bound patients, they need to be sitting up in their wheelchair for breakfast. And a lot of them bed-bound patients have wounds, right? So you need to do their wound care before they get up. Mind you, you can save that for after lunch and if they get back in bed. And, so that's up in the air. But if you're doing it before breakfast, that cuts into your med pass. Okay? Other things that cut into your med pass. Patients coming up to you, just trying to talk. Dementia patients coming up, doing what they do. Um, Staff come up to you, comes up to you, they want to talk. You know, it's a natural thing. They're walking by in the hallway, they want to say hi, they want to talk. That's a distraction. Other things, call bells. If you're the only one in the hallway and the call bell goes off, guess what? You gotta go to that call bell. And then once you go in there and get that call bell, now you're in there and you gotta do what they want. So that's more time. Then you just were in a room, right? Now you gotta wash your hands. And if corona's in the building, you need to put on your proper PPE and take it on and off, and then go in and out these rooms. Properly take them on and off, and properly wash your hands, and properly sanitize your hands. How about if you are doing your med pass and the pill is not there? It's missing. It's out. I should say it's out. You have to go to the Pyxis. That cuts into your 4.6 minutes. Say an emergency comes up. That's a good 10-15 minutes. Sending somebody out to the hospital, or doing first aid because they fell and had an injury, whatever happens. That takes a long time. And if you're going to the Pyxis for a narcotic, you need a second nurse to be a witness. This is all things that happen every day. All these things cut into your med pass. For them to give you 26 patients, 4.6 minutes a patient, is absurd. And also, you're not even allowed to give meds in the dining room. So their 4.6 minutes includes walking in the dining room, bringing them to their room, making sure they're safe while you go get their medicine and bring it back to them. That's 4 or 5 minutes right there. Just sit down and think about what I said after this video is done. Think about what is expected of you as a nurse. And think about the fact that it's essentially impossible to do it in 2 hours, and to do it correctly, and to do it without cutting corners. It's frustrating. We didn't go to school to rush through a med pass. We went to school to assess the patient related to their medication. We didn't go to school to rush through our shifts. And then they want to talk about med errors, infections, falls. How about you give us enough staff so we can even think about, what it is we're doing, and so that we can come into our shift and not rush into a med pass that's already rushed, that you're going to rush through. Maybe then we wouldn't have falls. If we weren't rushing through care, maybe we wouldn't have infections to the level that we have infections. Corporate and the state always want to come up with all these solutions, except for giving us the time to properly take care of these patients. Let me tell you, this video is not only for nurses. This video is for DONs, administrators, family members of patients in long-term care. This is what your nurse is going through. This is what she's going through if it's 26 patients on a 9 a.m. med pass. And if that's what you want, I don't know what to say, but this is absurd. This is unsafe, and they have been allowed to do this to us too long. And it needs to stop. It needs to stop. We need to let these people know that this staffing level, especially with the coronavirus, is not sufficient. Okay, so yes, there's things you can do about this, But use this video if you want. Use it as your argument. Go to your administrator. But that's a whole other video. I'm going to just stop talking because I talk too much already. So, like, comment, subscribe. Tell me, what are you guys going through? What is your experience with your math pass in your state? I'm in PA. And that's basically how it is for the average nursing home, I think. So, please, comment. Tell me what you guys are going through. Tell me what you think. Alright? Bye.